In today's matchup against the LA Rams, Taysom Hill of the New Orleans Saints suffered a significant enough leg injury that actually required him to be carted off the field, and here's what we know so far. Although we don't know the specific injury at this time, we do know that Hill's knee went into a forced knee hyperextension position, which is very, very risky for several structures that are located within the knee. With today's video, I want to first take a look at the injury replay. After that, we're going to do a brief anatomy review so that we understand the relevant structures in the knee, and finally, we'll talk about best and worst case scenario. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I'll also go over the relevant anatomy for that injury and talk about what that person should expect when coming to rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to this channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered a knee hyperextension injury, go ahead and comment in the comment section below. So we see here on the injury replay that as Taysom Hill is running with the ball, we see he's going to get an impact right here. And as this happens, it's going to force that knee bending backwards in the opposite direction in a position known as knee hyperextension. So here I have a model of the knee joint. And so the knee joint is formed by this top bone here, which is our thigh bone, also referred to as being the femur. That's going to come down and form the top piece of the knee. Then as we look at the bottom here, we have our shin bone, also called the tibia bone. It's going to form the bottom portion of the knee. And as I flip the model laterally or towards the outside, we have another long bone known as the fibula bone. Now, there are four main ligaments that contribute to overall knee stability. The first one is that anterior cruciate ligament, or the ACL for short, located in through here. As I flip the model medially or towards the inside, we have the medial collateral ligament, which is also known as the MCL. We're going to flip the model again laterally here, and we're going to have this lateral collateral ligament, also known as the LCL. And finally, on the back here, we have our posterior cruciate ligament, also known as the PCL. As we look further inside the model here, we have two pieces of fibrocartilage. They are the medial and the lateral meniscus. You can essentially think of these as being shock absorbers between the femur and tibia bones. Now let's go over the basic motions at the knee. So when we are bending our knee, this is known as flexion. So anytime you're doing a hamstring curl or something along those lines, this is going to be known as flexing the knee. The opposite of that, if you're doing a long arc quad exercise or anything like that where you're straightening the knee, that's going to be knee extension. Now, there are norm values for flexion and extension that are located within the textbook. They vary depending on the person, but for this particular case, we're talking about extension. The norm value for extension usually is around 0 degrees, which would mean that it's a straight line. Although clinically, a lot of people do have a little bit of knee hyperextension just naturally, but anytime we're talking about a knee hyperextension injury, this is forcing somebody to go beyond their norm value of extension. And you can see here that as I'm doing this, this is stressing all of those ligaments that are located in the knee, the MCL, the LCL, ACL, the PCL. And this is very concerning because anytime we're putting somebody in a very forced knee hyperextension, one or multiple of these very important structures at the knee could be at risk. So right off the bat, we know that several structures that are located within the knee can be damaged in this position. Usually when someone goes through severe hyperextension, that big one, of course, is going to be that anterior cruciate ligament. And it's because we are overstretching that ACL in this position. Also, when somebody is getting a force or some sort of trauma, that's going to force the tibia going anterior to posterior or from front to the back, this can greatly stress that PCL. So it's going to be doing this type of motion here, which is the exact type of motion that the PCL basically prevents from happening. A lot of times when we see people with a PCL injury, they're usually falling on top of their knee like this onto the ground, forcing that tibia to come upwards, or it can be due to some sort of a car accident. So in a car, our knees are bent, they're right by the dashboard there. But if somebody slams into the car, that knee can go ahead and hit the dashboard, forcing that tibia backwards. So we do see that sort of a trauma in this injury as well. So that's something to also be on the lookout for. And of course, anytime we have a blunt force trauma that's going to the knee here, we can't neglect potential injury to the bones, whether it be to the kneecap or the patella, which is usually visualized on a model like this. Anytime you go into a knee hyperextension like that, that essentially is going to cause that patella to make contact with either the femur and or the tibia there. If the impact is great enough, it can lead to fracture or potential damage of the femur and or tibia. So it really depends on the grade of the injury and essentially how severe it is. Anytime somebody is at risk for any sort of bone pathology, they're going to have an x-ray and or some advanced imaging to essentially rule out any sort of fracture there. There are some on the field tests though we can do to essentially determine if we think a specific ligament has been damaged. The one for the ACL is known as the Lockman's test. I've talked about this a lot on my channel here, but essentially what we're doing is we're going to be stabilizing the person's femur and we're going to be pulling that tibia forward because the ACL is going to prevent anterior translation. So if we do this and we feel laxity in this motion compared to the non-injured side, then we think that the ACL is involved. There's also something known as a posterior drawer test, and it's very similar to a Lockman's. It's just a little bit of a different position. And in this position here, what we're doing is we're pushing that tibia going backwards, essentially, once again, feeling if we have any sort of laxity going in the posterior direction, comparing it to the non-injured side. If we feel that laxity and it reproduces symptoms, then we think the PCL can be implicated. Any sort of ligament pathology, of course, is going to be diagnosed on the gold standard, which is the MRI. And this brings us to our grading system of these ligament injuries. There are grades 1, 2, and 3. In a grade 1 ligament injury, this is where you're getting overstretching of the affected ligament. In a grade 2, this is classified as a partial tear because you're getting partial tearing of that ligament. And finally, in a grade 3, this is where you're getting essentially a full rupture. This is going to be the worst case scenario. And a lot of times, depending on the structure that's implicated there, this is going to require some sort of ligament reconstruction. This is absolutely the case in the ACL, so that's going to be the big one here. So we basically need to wait and see if the ACL has suffered any sort of this grading system in terms of a ligament injury to give us an accurate time frame for Taysom Hill's return. Anytime somebody undergoes an ACL reconstruction is a multi-month up to about a year recovery time. So unfortunately, that would sideline him for the remainder of the season and will put him at risk for not starting the season on time next year. If also there are some other structures involved, not just a ligament, but multiple ligaments, maybe one of the menisci are implicated, as well as a bone bruise, this can greatly increase a person's recovery time as well. So once I happen to hear more updates regarding Taysom Hill's case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. If this happens to be more along the lines of a low-grade sprain of an affected ligament, usually these are not severe and they're not usually going to be season ending. We get these a lot in physical therapy because they don't usually require any type of surgical intervention. When we get them fresh after an acute injury like this, we're going to follow that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, E stands for elevation. Then as the person starts to feel better, we're going to work in range of motion exercises, as well as finally starting to work on strengthening depending on how their symptoms are. Anytime we're talking about rehabbing any sort of higher grade and or ligament reconstruction injuries, this is where the rehab process is going to take a lot longer, of course, because we're going to have a lot of surgical precautions initially. A lot of times after a ligament reconstruction, a person is in something known as a knee drop lock brace. Essentially, this brace is going to span going from the thigh, going over the knee, and going down to about the ankle. And this is because we want to make sure everything is in optimal place so that it has zero chance of re-injury, as well as giving it as much time to heal properly. Then depending on surgical precautions and how the person is healing, then we can start to work in and follow essentially the rehab process for that. However, once again, it's a multi-month up to about a year time frame. It really depends on how severe the injury was and the number of structures that were involved. So we wish Taysom Hill the best of luck moving forward. Although this was a very gruesome looking knee injury, there have been instances where somebody has suffered a knee hyperextension and it wasn't as bad as we thought. So once again, we just need to wait on the news, and that can give us a very accurate time frame for him to essentially come back and return full time. Thank you so much for tuning into my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thank you once again for tuning in, and I'll see you next time.